Good evening. Today I would like to talk to everyone in this class that has a family history of diabetes, has someone is overweight or inactive, to have their A1C checked immediately to be sure that you do not have prediabetes. I ask this so that you can live the life that you want. I'm sure that each of you would like to have a family one day and would like to live an active life. Checking your sugar today could help that happen. I would like to talk to each of you to have your blood sugar checked before you and your partner would try to start a family. For women, when you are planning your pregnancy, to ensure that you and your baby remain healthy. Gestational diabetes is a form of high blood sugar that affects pregnant women. It is very common, affecting about 200,000 women per year. For those that cannot have a child of your own, doctors will not artificially inseminate if your blood sugar ranges are above the 6s. According to the American Diabetes Association, the diagnosis of gestational diabetes does not mean that you had diabetes before you got pregnant or that you will have diabetes after you have your baby. However, when you are planning your pregnancy, you need to consult your doctor. For men, there is a connection between ED and diabetes. When men under the age of 45 develop ED, it could be a sign of type 2 diabetes. 35 to 75% of all men with diabetic men will experience some form of ED. According to the National Institute of Health, small blood vessels and nerves can be damaged by poorly controlled blood sugar levels. Reduced flow of blood from the damaged vessels can contribute to ED. There are lots of women and men in this room, and I'm sure that one day that you may want to have a family. That is one thing that has brought me the most joy in my life, is to have kids until I was a grandmother. You should have your A1C checked so that you can spend your money on something other than managing diabetes. As I mentioned in my informative speech, health expenditures for diabetes is 2 to 3 times higher than those without diabetes. 30% alone is spent on medicine just to treat the complications from the disease. According to the American Diabetes Association, the cost of diabetes has risen 26% in the last 5 years, and that's only going to increase. We know the pharmaceutical companies do not care about your wallet, only theirs. Don't put your hard-earned money in the hands of those crooks. I think you should also have your A1C checked if you would like to reduce the related complications such as amputation. Warning, the next slide is pretty graphic, so just beware. Complications from diabetes can include damage to the nerves and cause poor blood circulation. This makes feet vulnerable to skin sores, and if undetected and untreated, could worsen quickly, and amputation could be the only option. According to an article from the Mayo Clinic, more than 80% of amputees begin with foot ulcers. Some people are more at risk than others. Here are a few examples that can lead to amputation: high blood sugar levels, smoking, high blood pressure, and there are many more that you should probably check out. I'm sure that each one of you would like to have a life, an active life, and I'm sure you would like to do it on your feet. Think about the effects on your family if you were not able to enjoy the life that they needed. In conclusion, I would like to ask you again that while you're planning your pregnancy, consult your doctor about gestational diabetes, and if you have a family history of diabetes or overweight or inactive, take the time to get lab work. Taking a simple blood test to check for prediabetes could be the difference in your chance at having a family and an active life that you want to live. If I had known sooner, I may have been able to change the way that I lived and could have avoided getting diabetes. And I still struggle with the disease every day, and I hope one day that I will be free from diabetes. Thank you.